WakeMed Health and Hospitals presents Head to Toe, our fall seminar series. Now for tonight's featured speaker.
So help me welcome Jeff Herbst.
All right, thank you for having us. Over the last 10 years, therapy has really changed. It's come from, I think Dr. Wood mentioned, 10 years ago we'd see people in the clinic 2 to 3 times a week for 6 to 8 weeks, and now healthcare has changed a lot. It's really shifted towards a preventative care type system where we see people in the clinic, and if you haven't had a surgical operation, we're seeing people much less frequently. Okay, we do a lot of patient education on the front end, and we teach you ways, I don't want to say to heal yourself, but a lot of things that you can do on your own, okay, so you don't have to be coming and seeing us on a weekly basis. Dr. Wood's given us an opportunity to do a lot of injury prevention talks lately. We've talked to golf groups, tennis groups, high school athletes, seminars like this, and we try to tailor our talk to the individual patient population we are seeing. Dan and I are going to split up this talk. I'm going to take the first half, he's going to take the second half, and what we've decided to do is pick out 4 common injuries in adults that obviously are preventable, okay? And if they aren't preventable, teaching you to know the symptoms, okay, before they become worse, and that way you can treat it in your household. I'm going to first talk about lateral epicondylitis, rotator cuff and shoulder pain, and then Dan's going to take over and talk about plantar fasciitis and different knee injuries. The ones we picked tonight, again, they're usually all preventable, okay? And by the time you see a doctor or you see Dan or I in the clinic, it's gotten to a point where it's significant, all right? It's affecting your function in your home, at work, with your kids, and we'd like to prevent that, okay? So if you can notice the symptoms ahead of time, recognize the symptoms, treat it early, sometimes you don't even have to see a doctor or see us in the clinic. We'll first talk about lateral epicondylitis, also known as tennis elbow. Dr. Wood talked about it's an injury or repetitive microtrauma to the muscles and tendons on the outside of the elbow. It usually results from overuse or repetitive stress to the wrist extensor tendons. It's kind of a misnomer. It's well known in the tennis population as tennis elbow, all right? It can happen to anybody, anybody with repetitive stresses to their arm. It can happen to somebody who knits a lot. It can happen to somebody that does a lot of hammering, okay? A lot of screw driving, all right? It can happen in a lot of different areas. Computer work, okay, where you're not in a proper position and you're using your fingers. So it can happen in a lot of different areas, just not tennis players. Knowing the symptoms. It's really important in all the conditions that we're going to talk about is knowing the symptoms early on so you can treat it. So it's not only about injury prevention. We're going to show you exercises basically on every one of these topics. A lot of times people don't do exercises before they feel the symptoms, okay? So if you know the symptoms and you can notice them quickly, you can say, oh, I remember that talk and we talked about that, and I can go back and maybe look at these handouts and get on with the exercises and get this to go away very quickly. With tennis elbow, just real quickly, if you put your hand out in front of you and then you reach the outside, you're going to feel a bump, like Dr. Wood said. And then turn your arm over, okay? And if you bring your wrist up, it's basically right here are your wrist extensors, okay? And this is where they insert, okay, right on your lateral epicondyle. And this is where you'll feel point tenderness, okay? So if you have pain there or you poke around, it's like, oh, it's real tender, it could be beginning of something a little bigger. Other symptoms that you might have, difficulty holding on to or pinching or gripping objects, insufficient elbow and hand movement, and insufficient forearm strength. Very, very important to recognize the symptoms first, okay, before they become chronic. With chronic tennis elbow, I should say, when you notice the symptoms first, these are very treatable. You can treat them very quickly. They will go away. But if it becomes chronic, and that's usually when Dan or I will see people in the clinic is it's something that's bothered you for months. All right, and at that point, rehab is definitely a viable option. It just takes a lot longer to get rid of it. Okay, usually about 6 to 8 weeks of PT to get rid of a condition like this. But again, if you notice it earlier, we can get rid of it much quicker. Dr. Wood talked a lot about RICE with a lot of conditions, okay? And that is rest, ice massage, compression, and elevation. With tennis elbow and with the other subject, I'm going to go through, this says treatment if you notice the symptoms. If you're a person who takes part in a lot of painting, or you play an instrument, or you do a lot of activities that are fairly repetitive with your lower arm and elbow, it's going to be good to do these exercises just as part of a normal routine, okay? So first we're going to talk about RICE. If you notice the symptoms, you can't keep doing it, all right? That's the first sign. If you're having pain, you got to rest it. That doesn't mean stop total activity at all, okay? We want you to be active, and as long as it doesn't hurt, it's okay, all right? The more you're active, the more it's going to increase blood flow, and it's going to allow that area to heal. But if you have pain and you continue to do the same activity, you're basically hurting that tissue at that site. Ice. Ice is a very quick healer with something like this. So if you notice the symptoms quickly, you can wrap an ice pack around that area, okay? With some compression, you can leave it on there for 10 or 15 minutes. Another good way to treat this is with ice massage. Has anybody used ice massage for on anything? Okay.
Ice and paper cups.
Exactly. You can take an ice cube and do it, or as this lady said, you can take paper cups and fill them with water and put them in the freezer and just tear them down and just do an ice massage right over that area. It's very superficial. It's going to decrease the inflammation, the pain, and the swelling that's occurring. Yep. Stretching, okay, these are two of the most common stretches for tennis elbow. Very simple, and there's a little bit of a progression. If you're not having the symptoms, okay, and you're doing it more as an injury prevention, what we tell you to do is warm the muscles up. Okay, there's a lot of research going into stretching warm muscles versus cold muscles. All right, if you're a tennis player, you can do some light volleying with a partner against a wall. If you do other activities, just wrist circles. Okay, active wrist extension and flexion. All right. If you're having pain, I wouldn't suggest you starting a stretch with your arms straight. Okay, that might aggravate the muscle. Start first with your elbow bent. Okay, if that's not painful, then you want to start straightening the elbow. Okay, so another thing I want to mention is this is tennis elbow. There's also golfer's elbow. It's on the inside. Okay, your medial epicondyle. Golfer's elbow is not as common as tennis elbow, so a lot of times when we talk about these conditions, we're talking about tennis elbow. But two stretches, one, arm out straight, okay? You're going to pull back on your wrist, okay? And that's going to stretch right there, this part of your forearm, okay? All right, so it's going to stretch the wrist flexors of your arm. All right, and then the more specific stretch for your tennis elbow is going to be your wrist extensor stretch. Okay, and you should feel a stretch coming right from that lateral epicondyle just kind of into the muscle belly. All right. So again, it's a good way to prevent injury, but if you notice the symptoms, I would start with those stretches. Next is strengthening. Again, this would be more of a preventive strategy before you have the condition. Okay, these are very easy exercises. You start with very light weights. These are 1 and 2 and 3 pound weights. If you have pain already and you're in the stretching phase and the ice phase and the NSAIDs phase, I wouldn't want you to start strengthening until it's pain-free. Okay, if you're strengthening a muscle and it hurts and you're having the same point tenderness over that area, you're just irritating the tissue. Okay, you have to wait a little longer. But if you're doing this as an injury prevention program and you don't have a problem and you just don't want to develop it, all right, start with 1 and 2 pound weights. All right, and it's very easy. You just put this pretty much right over your leg. Okay, this is a wrist extension exercise. All right, and what I would suggest is 8 to 12 reps, 2 to 3 sets. Okay, a very light weights though. This isn't something you pick up a 5-pound weight and just start doing it, because you will develop tennis elbow, okay? But you want to start with real light weights, 1, 2, and 3 pounds, all right? The next one's wrist flexion, okay? And it's just bringing it up like this, okay? And the pictures will hopefully be part of your handout. The next one's forearm pronation and supination. And they use a hammer. It's a very easy way to do it. You have a real heavy end and a lighter end, okay? And you can control the weight on that, all right? If you want a lot of force, you're going to grab at the end of the hammer, okay? And you're going to do this type of motion. And again, I'm going to get down like this. You can put it right over your leg like this, and you're just doing this motion right here, okay? If you want less force, all you do is move your hand up into the middle of the hammer, okay? It's not going to be as heavy, okay? And then if you want to add more force, sometimes people have like plumbing wrenches and stuff like that with big heads on them. Everybody can find something in their garage that'll give them a little more weight. And then the other one's a simple ball squeeze. All right, so if you have a tennis ball or something like that at home, squeezing it for about 5 seconds, relaxing for about 5 seconds. Squeezing for 5 seconds and relaxing. And again, about 20 repetitions. And doing these exercises 3 to 4 times a week. Okay? But the general rule of thumb, if it's painful, you need to stop. You're probably going to hear that a lot in these injury prevention programs, okay? If it's painful, you're injuring tissue. We're going to talk a little about tips to avoid injury. Use correct techniques and movements during activities. We talk, tennis elbow is obviously most known for tennis. If any of you guys are tennis players here and have had it, it's a lot of time with backhand, the backhand swing in tennis, okay? A lot of people will end up using their wrist with their backhand. So what we do is you want to really try to keep a straight wrist, okay? Keep the pressure off the wrist extensors. It also is in other areas, okay? You want to be using your bigger muscles to perform the activities versus using more of your wrist. So we're going to talk about it later, but getting with a good tennis professional, okay, that can show you proper technique. Lifting, okay? A lot of times people will lift and they'll lift like this, something heavy, and they'll pull it up like this, okay? You can imagine how much pressure that's putting on your lateral epicondyle and those small muscles in your forearm. So always lift with your palms outward. Use appropriate equipment for ability, body size, and strength. Again, this can be for tennis players. Using the correct racket will prevent excessive force going through the arm. Okay, if you go to a reputable tennis shop, they're going to be able to look at the size of your grip. All right, they might recommend a smaller grip if you have a smaller hand, or a bigger grip if you have a bigger hand. Head size. Okay, there's a lot of things they can do with rackets and how much they weigh, and also string tensile strength. Okay, they can change the strength on the tennis strings. Okay, same thing with golf. Okay, they can advance you to a stiff shaft, a regular shaft, or even a senior shaft. This goes for other jobs too. I mean, everybody's in their house and painting their walls or painting this and that. All right, you've seen those big 5 or 6 inch brushes and how heavy they weigh. Okay, versus a 2.5 or 2 inch brush. Sometimes you have to know that you're not able to operate something that's that heavy in such a repetitive fashion. Another thing is with computers. Okay, computers, a good thing to have is a hand rest. All right, something to rest your wrists on, so you're not always holding them up in extension. Okay, and putting pressure on those muscles all the time. And if you're in the construction trade, hammers. Okay, hammers come in all different weights. All right, you don't need a real big hammer to put in a bunch of brad nails. Okay, but if you're constantly doing that activity, you might start, affecting that area and having pain. Avoid repeated movements. Okay, alternate hands, and this goes with if you're a gardener. Okay, if you're right-handed, you're almost always going to do something with your right hand. Try using your left hand. But this goes for any activity. If you can alternate hands, do that. If you need to, take a rest or avoid those repeated movements. Strengthening shoulder, legs, and back to decrease stress on the elbow. Okay, it's going to be real important to be fit, especially in your shoulders, your back, and your legs to take stress off your elbow. I should have said stretching too. Okay, because if you're not fully flexible in your shoulder, okay, and I'm going to use tennis as an example again. If you lack external rotation, meaning you're not able to get your arm out like this, and we're going to talk about that a little later in the rotator cuff talk. If you go and do a backhand and you don't have that external rotation to really open up, what are you going to do? You're going to get here and then you're going to flick it like that. So as a therapist, we're looking at other areas of the body to say, okay, why are you playing this way, and why are you developing these type of symptoms? Bracing. Has everybody seen the tennis elbow braces?
Yeah, they go around here.
That's right. That's right. They basically are straps that are worn around your forearm, okay, just below the elbow, and I think there's a picture on there. It basically eases the pressure on the tendon by distributing pressure throughout the arm, all right? So if you think of a real long moment arm, it's basically breaking that moment arm up so you're not having such extreme pressures right at the insertion of your wrist extensors, okay? They can be very helpful, very, very helpful. But you got to think back to the stretching and the strengthening part. Okay, they're not the answer. They're the answer to allow you to play, but you need to start treating the problems so you can start getting away from the bracing. And the last thing is, this is specific to tennis players, but seek out a skilled coach in a reputable equipment shop. I'm not a tennis player. Okay, I'm a golfer. I can speak on golf a lot better, but tennis. Seek out a professional, all right? We do golf conditioning classes, but we're not golf professionals, all right? Seek out a tennis professional, explain your problem. They'll look at your swing and be able to give you some advice. Also, reputable tennis shops in the area, okay? They're going to understand tennis elbow and problems people have playing tennis. All right. I'm going to move on to rotator cuff and shoulder pain. Dr. Wood already explained kind of what the rotator cuff does. I'm going to kind of reiterate that real quickly. Rotator cuff is muscles and tendons in your shoulder that connect your upper arm bone to your shoulder blade. The primary function is to provide stability to the shoulder so the larger muscles can move it. And the result is the shoulder has the greatest range of motion of any joint in the body. Okay, it can move through a lot of different planes. All right, the rotator cuff really, its job is to compress the humeral head, preventing superior migration. Okay, and what that means is, when I lift I got to stand in front of the microphone. When I lift my shoulder up, okay, it all kind of works together. You don't see everything kind of rising up like that. So what your rotator cuff does, when you lift your arm up, it centers it right in the middle of that glenoid. Okay, with a good working rotator cuff, when you lift it up, just keeps it right there, okay, and you don't pinch. All right, with a poor working rotator cuff, or if you have some pain, what happens is it migrates superiorly, okay, and you saw on the slides with Dr. Wood, and we don't have all those nice fun arthroscopy slides, but what you can see is there's a lot of tissues right at the top, so when it migrates up, there's a lot of things that pinch. There's bursitis, there's impingement, there's tendonitis, there's a lot of things going on up there. If you've ever seen anybody with a shoulder injury, or we talk about kind of people that walk, we can kind of pick out a hip problem because they walk like this, okay? A shoulder problem, you'll see somebody lift up and they look pretty good to here, but what do? Then they do this to get up here, okay? Because they don't have a good working rotator cuff to center it in the joint so they can elevate it nicely. In therapy, when we're working with the rotator cuff, it basically creates space in your shoulder. So when we're working with patients, it really doesn't matter. It's almost all conditions of shoulder pain. We're working to create space in the shoulder, okay? And it's different with everybody. It might be mobilizing the shoulder. It might be strengthened in certain areas of the shoulder. But the rotator cuff creates that space. So we need to get that working properly again. Here's a picture of the rotator cuff muscles. Again, the one on the left side, okay, is going to be a frontal view of your shoulder blade. That's a right shoulder. And that's showing at the bottom your subscapularis muscle, okay? And I'm going to You don't need to remember this, but when we get to the exercises, we're going to talk a lot about internal and external rotation. That subscapularis muscle is very much responsible for internal rotation. All right. If you look at the slide on the right, it's going to show your teres minor and your infraspinatus muscle. All right. And those are external rotators. Okay. A very important function of your shoulder to be able to clear it so you can lift your arm up. And the other one is your supraspinatus, and that is the most commonly one that's injured and the most commonly one that's also repaired. All right, so those four muscles make up your rotator cuff, and they provide stability to the shoulder. Injuries can range from small tendinitises to tears. Okay, and we're gonna mostly talk about, in our talk, we're gonna talk about noticing the symptoms or even preventing the symptoms. So we don't want it to get to a tear. And actually, I think Dr. Wood might have had a picture like this, but on the right side where it has rotator cuff injury and it shows compression point, okay, that shows where when somebody elevates their shoulder out to the side, and we're going to talk a lot about overhead movements, okay, that's where people usually start impinging and having problems. Risk factors for injury. Age, normal wear and tear. There's a greater percentage of rotator cuff injuries occur over the age of 40, and they're usually degenerative tears, okay? Athletes, and you can see a picture of a boy right there with excessive external rotation. I'm a very tight individual. I can only get to here. This is normal, but he's got external rotation back to here. So athletes, you're going to see more of the acute injuries in your swimmers, in your baseball pitchers, and your overhead athletes. Construction trade jobs, okay, repetitive stress jobs, carpenters, painters, doing overhead type construction, jobs. You can see the picture on the right. Just you can imagine somebody working up over their head for long periods of time. Posture. A lot of people have forward shoulder posture. I am one of them also. We talked about space and how the rotator cuff creates space in the shoulder. If you think about somebody with poor posture, and you can see that person with this type of posture, all right? If I stand up with good posture, look how far I can elevate my shoulder up. Okay, I don't impinge, I can lift it up nicely, but what about doing like this, poor posture? This is as high as I can go. So you can imagine, I'm not even that far up over my head, but if I'm doing a repetitive activity and I have poor posture and I'm in this position, it's not going to take too long for you to start noticing symptoms in your shoulder. Weak shoulder muscles, and we're going to get to that. We're going to go through some exercises, or at least visually show you some exercises that are going to work on your rotator cuff. It's the number one thing that's going to decrease your risk for injuring your shoulder. Lifting, pulling, falling. Sometimes things you can't avoid. But you can avoid lifting mechanics. Okay, so poor lifting mechanics. Think about lifting something heavy. You want to keep it close to your body. You want to use your legs. And you want to keep that weight as close to your chest as you can, even if you're coming up high. It's much different than we see people that will lean over, will grab something like this, and they rotate over, and they try to put it up here. Obviously, you're at a more chance of injuring your shoulder. Pulling. We see a lot of people in the clinic that have injuries, and this is a very common one, but if you fly a lot, putting stuff in an overhead compartment, and even worse, pulling it down because you've shoved that thing in there, and then you go and you try to pull it down and it doesn't come, okay, but you end up hurting your shoulder. Some other examples, pulling a lawnmower cord, all right? Sometimes that lawnmower cord comes right out, and sometimes you go up and you pull as hard as you can and it doesn't go anywhere, okay? That's another common way to injure your shoulder. So be careful with those type of activities. If any of you guys are hunters, I'm from upstate New York. Everybody hunts. We used to see a lot of high-tension bows, okay? You get a little older and you want to pull that bow back as hard as you can, and that's just another way that people injure their shoulder. And falling, okay? Falling is a very common way. What's the first thing you do? You put your arm out to stop yourself from falling, and we see a lot of injuries that way. Prevention of injury, all right? You're going to hear this a lot. Rest. Take frequent breaks during repetitive arm use. You have to avoid the movements that cause pain in your shoulder. And if you're having pain, you need to switch hands, or or you need to stop and take a rest for a little while. A position that a lot of people get in is that everybody put their arm out the window of their car on these nice fall days, okay? And we'll have patients come in and say, that hurts. Don't do it, okay? You're getting in that impingement position, and you leave that arm there for 15 minutes, you have the air coming in, and then you complain about your arm hurt. You can't do it, okay? You can do it after you do the strengthening exercise and the flexibility, and then hopefully you're going to be able to get in that position. But just don't continue to do things like that. Some of it's common sense. Avoid repeated overhead movements, okay? So if you have to do, if you're painting and you're trying to get up high, okay, get a step ladder, all right, or get a ladder so you're operating in this, you know, in this angle more. You don't want to continue to do the same thing that's going to start bothering your shoulder. I got a kind of a funny example. It's not funny for this person, but we had a patient who just bought a Wii. Everybody know what a Wii is, the new gaming system where it's very interactive, there's exercise. And she wanted to box her husband. And she did a repeated movement for 3 rounds, and she didn't want to hit him in the gut, she wanted to hit him in the face every time. So she did this. Okay, for I don't know how many minutes, what's a round? 3 minutes a round, 9 minutes, okay? It didn't hurt her until she woke up in the morning. She ended up tearing her rotator cuff and having a rotator cuff repair. We saw her in therapy for 2 weeks, and we said, I don't think so. And she ended up having a rotator cuff repair. Again, I told her if she would just have a gut shot once in a while, it would have been fine. But no, she wanted to hit him in the face. We already talked about keeping good posture at all times. Okay, it's tough to maintain good posture. So sometimes you need, you know, things to aid you, like a lumbar support, okay, or a good fitting chair that has a little lumbar support in it. We always tell people good posture is military, and then relax, okay, and then there's bad posture. All right, so somewhere in the middle. It's tough to maintain military posture all the time. But if you can rest, that's proper posture. Avoid catching falling objects. Again, what are you going to do when something falls? The first thing you're going to think about is catching it. But if it's something very heavy, that's a good chance you're going to injure your shoulder. And ice. Ice is kind of your number one thing that even if you're not having any pain, but you were outside, you know, I don't know what you were doing, messing up over your head for a long period of time. Cutting. I actually had that example, yeah. Okay, those crepe myrtles that everybody likes to trim, they do this for half an hour, 45 minutes. Go in and ice it, okay? Even if you're not having pain, all right? They'll probably prevent you from having pain the next day. All right, exercise. That's probably what you kind of came to see. What I did is I listed 5 different exercises here. The first one's just a posterior shoulder cuff stretch, and that's just reaching behind. Yes? So the first one's a posterior cuff stretch, okay, pulling across your body. All right. The next one's a little bit of a lateral shoulder stretch and also a lat stretch, all right, and that's pulling back like this. And again, with all these stretches, I'm not going to hold it for 15 to 30 seconds, but you want to hold it for a period of time where that tissue has a chance to change. The other one's a towel stretch, okay? When people have rotator cuff type injuries or shoulder pain, women will say, I can't get to my bra strap. Men will say, I can't get to my wallet or my belt, okay? Or women will say, I can't do the back of my hair. I can't curl my hair. So these are very common positions. People have trouble getting here, and they have trouble getting here, okay? So we're going to stretch one with a towel. You're just going to put a towel behind your back. You're going to grab it, and then you're just going to pull it up your back so you're getting a good internal rotation stretch. Okay. I showed a doorway stretch on here. If you're having pain, I wouldn't want somebody to put their arms way up over their head and lean into a doorway and get a good anterior chest and external rotation stretch. It shouldn't be painful. Okay. You might have a burning stretch pain. That's okay, but you shouldn't have the same pain. So start low and then progress your way up as you're able to. The other one, I don't love this picture, but I think it's real important to stretch out your thoracic spine, okay? If you become kyphotic with poor posture, again, that's going to affect your shoulders. So what I like people to do, and you guys have backs on your chairs, is putting your hands behind your head and actually bend back over the chair, okay? And you can actually change, these chairs kind of lean back so it's tough, but you can actually change the different levels you stretch by kind of slouching down a little bit or sitting up, so you can kind of stretch each level of your thoracic area. Okay. the more you open yourself up, the more space there's going to be in your shoulder. Okay, let's move on to strengthening, all right? It's shown that a balanced shoulder strengthening program, okay, including rotator cuff specific exercise, can decrease injury to the shoulder. What I listed on here, and I'll kind of go through every single one individually, but the first two on top are external rotation strengthening exercises. And you can do it laying on your side with a dumbbell. Again, these are not things you want to take a 5 or 6 or 7 pound weight. All right, you're going to start very slow with 1, 2, 3, maybe 4 pounds if you have really good strength. Okay, but you can lay on your side and externally rotate. You can also use TheraBand or a sport cord or something like that. Attach it to a door and do external rotation like this. Okay. The next one is internal rotation. So with the sport cord or the TheraBand, you're doing the same thing, but you're pulling inwards. Okay. Or you can lie on your affected side like the next picture shows, where you're bringing it again in towards your chest. Now to advance those exercises, if you go to the one in the lower right-handed corner right there, all right, what we want you to start doing is start strengthening down by your body. Okay. As you get stronger, where do we function? Okay, we like functioning up here. Okay, we like functioning out here. So you can progress these exercises a little further away from your body. You can put a pillow in here and do the same exercises. You can put a ball in here and squeeze it to your chest wall and do the same exercises. So the further you get away from your body, the more functional it is. Okay, but I would start closer to your body at first. The one in color, okay, that one's for your supraspinatus, and that you can strengthen your supraspinatus a couple different ways. People call it the empty can position, where your thumbs are down and you're lifting it up in the scapular plane, so you're not out to the side, you're not in front of you, you're kind of in the middle of the two. Okay? You can either do it with your thumb down, but the only thing I warn you about the thumb down, with your thumb down, you impinge your shoulder if you come all the way up here. So if your thumb is down, you only want to come to about 70 degrees and back down. You don't want to keep doing this. Bringing it up as high as you can. All right. With your thumb up, all of a sudden it frees up your shoulders, doesn't it? Okay. But I would still strengthen these to about 90 degrees and down. Okay. That is it for my body.
So help me welcome Dan Sear.
What's going on here? Get some height. Good job, Jeff. That was awesome. All right, I'm going to talk about plantar fasciitis and knee injuries. First, I'll start with the plantar fasciitis. And as you can see on this image here, the plantar fascia is also known as the plantar aponeurosis. It attaches to the heel, right where the bone that's called the calcaneus is. So that's, let's see if I can find, there we go. That's right in this area right here. And the plantar fascia goes all the way to the ball of the foot. The plantar fascia basically acts as a band that supports the longitudinal arch of your foot. So the whole arch of your foot is what it supports. What ends up happening with plantar fasciitis, it's basically inflammation. Usually happens right around this area where you see that little tear. And that's from repetitive stress and microtrauma over time. Usually a patient comes in our office saying that they have heel pain. I think Dr. Wood alluded to it earlier. First step in the morning, right when they get out of bed, their heel hurts. What tends to happen is as they warm up, it starts to go away. So as the day goes on, the pain goes away. Maybe after sitting for a little while, if you have a desk job, you sit down for a while, you get up, the heel pain comes back again. Those are common signs of plantar fasciitis. Another thing that happens as well is some people that are in less, they're not as inflamed. They may have not have as much pain in the morning, but if you run or walk a lot, the more you walk, the more you run, the more the heel will hurt. Some of the causes of being predisposed to plantar fasciitis is your biomechanics, and that means basically if you have really high arches or really low arches. If you have really high arches, that's called a supinated foot. There's less flexibility in a high arch foot, so what happens is you end up putting a lot of weight on your heel when you walk, instead of dispersing it through your whole foot and the arch. More commonly, though, people with low arches get plantar fasciitis. And again, because the plantar fascia supports the arch, what ends up happening is basically, kind of, if you look at my hand here, if your arch is here, and every time you step down, your foot comes down like this. If you're not wearing shoes, your foot will come down. What happens is it keeps giving tension. So it's a tension band that pulls on the plantar fascia, and it creates that trauma down to the end of it. So you can be predisposed if you have really high arches or really low arches. Another cause that can predispose you to plantar fasciitis are tight calf muscles or toe muscles, your first toe rather. What happens when you walk is your ankle goes into a position called dorsiflexion, and if you have tight calf muscles or that tight toe, the motion has to come from something. And usually that's when the plantar fascia has to take that brunt of the motion, and that's where you get that irritation. Another thing is poor footwear. So if your plantar fascia is responsible for the arch and you have nothing to help it support the arch, again, people wear flip-flops a lot nowadays, and those aren't really geared towards proper comfort. They're getting better about them, though. They have some good, so they've made some improvements with the arch support in flip-flops. And then women with high heels, there's really not much support there. So that's where the plantar fascia has to really take all that support. Prevention. It's a real simple thing for plantar fasciitis. Number one is just get the right footwear. Making sure you have the right arch support. Some people prefer a soft heel cushion. Some people prefer more of a stable heel. What I recommend for people, if you don't know, get a foot assessment. There's a bunch of places locally that now have pads that you can stand on, and then they watch you walk. And I can give you names of places, depending on where you live, that will show you kind of where you're putting weight on your foot and what type of sneaker you should wear. The second thing for prevention is stretches. Again, you've heard from Jeff, stretching is so important. The first stretch there is a big toe stretch, and as you can see, they're pulling their toe back, but they're also pulling their ankle up, and what happens is that stretches that plantar aponeurosis. The second one is using a band or a towel or a sheet or something and pulling your ball of your foot towards you, and it stretches your calf muscle out. Now, these two stretches I usually recommend when someone has really bad plantar fasciitis. Before you get out of bed, it's good to stretch, because that first step in the morning, if you haven't stretched, all those collagen fibers that have been laying down there all night tend to rip apart, and then you get a lot of pain. So light stretching before getting out of bed is real important. Now, stretches as far as when you're warmed up or walking around are the first one is a calf stretch. There's two calf muscles, and this one right here is stretching one of the calf muscles. That's your basic runner's stretch. Okay, you're leaning against a wall. You put the affected leg backwards, and you lean forward, and you stretch your calf. That's going to get one of the calf muscles called the gastrocnemius. The gastrocnemius goes all the way up to your knee. So in the bottom picture, right here, you can see where they have a bent knee. And what that does is that stretches a muscle called the soleus. That's the other calf muscle. In the top picture, you should feel the stretch in your upper calf. And in the bottom picture, you're going to feel it kind of where your Achilles tendon is, so a little bit lower. A lot of people miss out on this stretch when they're stretching. You'll see a lot of runners do the top stretch, but not the lower stretch. A third stretch is just a stair stretch. So standing on the end of a step, sorry about that, and letting your body weight come down until you feel stretch in your calf muscle. Again, as Jeff said earlier, you want to hold these stretches for 15 to 30 seconds, real gentle. If it hurts, back off a little bit. Don't push through that pain. It's not like that phys ed teacher when you're in high school or something saying push, push, push with a stretch. We like to have them real gentle. And the fourth stretch right there is the big toe stretch at the wall. Okay, so you just put your foot right up against the wall where the wall meets the floor, and just lean forward and drop the toe down a little bit, and you'll get a stretch through that. Other prevention options, yoga is a great way to go. They do a lot of flexibility exercises. They do a lot of stuff that focuses on your hamstrings and your calf muscles, so that's a good way to go. Dr. Wood mentioned orthotics earlier and heel cups or wedges. I don't go the orthotic route early with patients. So if that's what your gentleman at the mall was trying to sell you, I wouldn't have gone with orthotics early on. There's been some studies recently that show that people with orthotics, about 85% of them don't need orthotics. They just need proper footwear. Sorry, I'll leave that alone. I won't give my 2 cents on orthotics. But usually people don't need them. That's the last case resort. Another prevention thing you can do is just a foot massage. Here shown is someone using a golf ball, just rubbing it up and down. Blood is the way to heal areas. Just like Dr. Wood said with surgery, they try to irritate an area, creating some blood flow. And massage is the same thing. You get some blood flow to the area, so you can do it to yourself. The next thing you can do is you can see that bottle of water there. You can fill a bottle and throw it in the freezer. Get it frozen, and you can rub your foot back and forth, and you can do an ice massage like Jeff described earlier, but you can do it to the arch of your foot. And the last thing, again, is night splints. Dr. Wood mentioned that earlier. That will hold your foot in the right position throughout the night, so when you do step first thing in the morning, you're already kind of stretched out. Okay, and that's it for plantar fasciitis. Knee anatomy, I won't go in too deep. Dr. Wood did earlier about the knee, but I'll just orient you to the knee itself. Here's the kneecap. Oops, keep touching that. Sorry. And here's the meniscus right inside the joint. Here's a picture of the ACL. Here's the ligament on the inside of your knee called the medial collateral ligament. And on the other side is the lateral collateral ligament right out on this area here. And this is just another way to orient you right there as far as the picture here. This one actually shows a little bit more of the cartilage in here. Okay, sometimes you'll come to our office and this is what we're going to tell you. It's a physician talking to a frog. It says, of course your knees hurt. It's all that darn jumping up and down you do. And unfortunately at times, we get people who come in playing basketball 3 times a week or tennis 4 times a week. And there are times, like Dr. Wood said, where cartilage doesn't regrow. I think I'd be a rich man if I could find out how to regrow cartilage. But it doesn't happen. It's basically the gold of the knee. You really want to protect it. And at times, a lot of running, jumping up and down, that will wear your cartilage down. So we don't always have the cure, but sometimes it just means modifying your activities. Here's a picture of arthritis. You can see in the middle here, I'll try not to change the slide. You can see in the middle here, that's where there's good cartilage right in through here. Arthritis is when that cartilage breaks down. And so this would basically be the backside or right in the front of the knee where your kneecap attaches or kind of rides on. And when the kneecap rides on arthritis like that, that's where a lot of people get knee pain. That's when you extend your knee or go up and down the stairs, you hear that cracking and popping in your knee. That's called crepitus. That's typically an indication that there's some wear and tear in there. Again, meniscal tears were talked about earlier, and here it's just showing a meniscal tear right in this area on the lateral side here. We also talked about, Dr. Wood also talked about ACL tears. Typically an ACL tear will happen from someone pivoting on their knee. And on the right side you can actually see where the tear is. Okay, I know I'm going quickly through these slides, but it's more review here. The interesting thing about ACL tears, I do injury prevention talks to soccer players all the time, and I always ask the question, do you think ACL tears happen from contact or non-contact? And the majority of the time the kids think it comes from contact. Well, interestingly enough, 7 out of 10 ACL tears happen from non-contact. The ones you see are contact was, like the video shown earlier, where someone is playing football and they get hit from the side. Recently, I guess a couple years ago, Tom Brady, kind of a famous quarterback, got hit, tore his ACL. But 7 out of 10 of those ACL tears are non-contact. So why are people having those ACL tears without contact is the question we've been asking ourselves. And over the years, they've done more and more research, and they're looking at things like shoe versus playing surface. Are you wearing tennis sneakers to play basketball? Or are you wearing turf shoes on a grass surface? Or are you wearing turfs, or vice versa? Other studies they've looked at is joint laxity, if they don't have a lot of stability in their knee. Things like limb alignment as well, if you're really kind of knock-kneed or if you have bow-legged knees. Some things they've been looking at more recently, especially in females, is notch dimensions and ligament size. Is the notch where the ACL attaches smaller? And also, are the ligaments smaller themselves, so maybe less able to take that tension that you put on your knee? They've done some research on hormones. They've checked menstrual cycles. When are young girls tearing their ACL? Is it related to their menstrual cycle? Other things that especially we've been looking at a lot is strength imbalances, whether it's in the hip, in the quadriceps, which is in the front of your thigh, or in the hamstrings, which is in the back. And another thing we've been looking at are landing positions. Are our athletes landing kind of on a flat foot? Are they landing on the ball of their feet? Are they landing with their knee over their toes, or is it kind of carving in and they're landing kind of crooked? So all of those things we've been looking at, but really the truth is we don't know why. We're not 100% sure, and that's really what's kind of been going on. The good thing is that we know that prevention programs are working. There's a huge program out in California. It's called the PEP program. It's a Performance Enhancement and Injury Prevention Program. They took 3,000 soccer players and broke them up into two groups. And they told one group, just go ahead and do your normal stuff, practice, do your drills with your coach, play games, and they were checking their progress. And then they took another group and they said, do those same things, except we're also going to have you do a specific warm-up, specific agility and plyometric drills, specific strength and flexibility and balance exercises. And what they did is they found after a one-year study that they had an 88% reduction in ACL tears in the group that did all the exercises. And then after a 2-year follow-up, they found a 74% reduction. Another program that is actually going across sports, that first one was in soccer. They're doing some for tennis, volleyball. They've actually added basketball recently. And they're doing male, female athletes. They're doing a bunch of different ages. It's called Sports Metrics, and it's out of Cincinnati. You can definitely look that up or Google it. There's some good information there as well. But my point of these two studies is that prevention programs are working for preventing ACL tears, but we're also trying to carry that over into preventing other knee injuries. And so the things that I'm going to show you guys today, typically when I do this talk and I'm talking to 18-year-olds, I'm having them do the plyometric and agility exercises. But once we get to anywhere around 35, 40 years old, I usually don't have them do that. I just have them focus on the balance component, the flexibility component, and the strength component. And again, that's to preserve the cartilage in the joints. The first exercise, we've been sitting for a while, and actually we don't have too much longer, but why don't everyone stand up for me, if you don't mind. Just kind of stand where you are. And I just want you to stand on one leg. Just pick a leg, doesn't really matter. And just focus on balance. Literally, the whole time I'm talking here, just focus on balance. And you can switch legs if you want, but try to hold. If you can get 20 seconds, that's considered normal balance. If it's less than 20 seconds, you probably need to work on your balance a little bit. So if you... working on that single leg stance is the easiest form of working on your balance. There's other things you can do. You can practice, as the second image shows there, you can practice reaching forward, reaching out of your base of support. That challenges you a little bit further. You can close your eyes. That challenges you a little bit more. We have young kids kind of tossing a ball back and forth. We have tennis players maybe just bouncing the ball on their racket while they're standing on one leg. And that works on kind of your neuromuscular balance in your body. There's a couple other devices you can use as well if you want more of a challenge. You can see that gentleman on the bottom left, he's using what we call Dynadiscs, and that kind of challenges you a little bit more. And then the one on the bottom right there is called a BOSU, B-O-S-U, and that's real good for balance as well. A lot of athletes use that. All right, you can go ahead and have a seat. Thanks. So you can see something that simple actually makes a difference. And, I'll tell patients, when you're sitting at the countertop or you're talking to your family on the phone or something, practice just standing on one leg, and you can do it, kind of knock two birds off with one stone. The next part is strengthening. The first exercise there on the top left is what we call a quad set. All you're doing there is you're pushing your knee down into the bed or the ground or whatever you're laying on, and you're tightening your thigh muscle. What that does is that allows, your joints have lubrication in them, and so what that does is that pushes the kneecap back into the joint, squeezing the fluid away from it, and then when you release it, the fluid comes back. So you're giving circulation to that joint without irritating the surfaces, especially if you have arthritis. And that also helps the kneecap track a little bit better. As Dr. Wood said, sometimes there's some malalignments in the knee, and that's one of the first exercises we work on to try to help with, to improve that alignment. The second one is a leg raise. So you're laying on your back and you're lifting your leg up. Again, this is a real safe one for a knee that has some arthritis in it because your knee is straight. You're not doing a lot of squatting or anything. So keeping your knee straight and just lifting the leg up will get your quadriceps muscles as well. The third one there is a knee extension exercise. And with that, again, you want to be real careful because that one, if you hear a lot of cracking, popping, or you have pain, that's probably the first one I would eliminate. A lot of athletes will work on that. Again, when you're 18 or 20 years old, that's a great exercise to strengthen your quad. It's a good exercise, kind of best bang for your buck. You'll really get strong quads, but the problem is you have a lot of risk with that as well. It's a high risk, high reward exercise.
High risk on your knees?
Yes, high risk on your knees because especially if you have arthritis, you can cause a lot of that compression of the kneecap into that groove right there, and you want to avoid a lot of compression. So I put it up there to say it's okay to do, however, be very cautious with that one. A little bit easier exercise that's a little safer for the knee is the one that's on the bottom left. And what that image is showing is someone holding one of those bands that's in the doorway, one of those stretch bands, and they're basically straightening out their leg from a bent position. That's going to get your quadriceps firing again, the muscle in front of the thigh. Standing up so it's a little more pressure. And then, of course, we want to make sure we get your hamstring, so a hamstring curl is a good idea, and that's what that next image is, just bending your knee. Stretches, again, you want to make sure you stretch your calf out. So the first image there shows both the gastroc stretch and the soleus stretch that I talked to you about earlier with the plantar fasciitis slides. So you have a straight knee, which will get the gastroc, and the bent knee, which will get the soleus. The next one is showing, it's a hip flexor stretch, so it's showing you stretching the front of your thigh. The bottom left, you see a hamstring stretch, and with that one, you really don't want to bend at your back. You don't want to arch your back and bend forward. I'd rather you, instead of grabbing your toes, keep your chest out forward and keep your back straight and lean forward, and you'll get your hamstring a lot better that way. If you can only reach to your shin, that's fine. It's a process, stretching is. The next one is a figure 8 stretch. What that's going to do is stretch your hip. In this picture, he's actually stretching his right hip. So what you do is you cross your right leg over your left leg, like the image shows, and pull your left knee towards your chest, and that will stretch your right hip. And then you do the opposite to stretch the left hip. And then the last image shows a quadricep stretch, but just laying on your belly. It's kind of like the last one on the front row. And the more flexible you keep your knees, the less compression you will get through that kneecap. Okay, so it helps preserve the joint.
Say that again? The more what?
The more flexibility you have, the less compression you'll have of the kneecap on the joint. There's other prevention options, and again, Dr. Wood did talk about bracing. It's not the first thing we go with, but we get patients who come in all the time that swear by their braces, and that's fine. This one in particular is that patella cutout, like we talked about. That may help you if you have a malalignment issue, keeping your kneecap in the right groove. And the other thing is supplements. And again, supplements aren't necessarily regulated, but I get patients all the time that come in and say glucosamine chondroitin makes a difference. I get some that say it doesn't do anything for them at all. Usually what I'll recommend is for people to go out and buy it, try it for maybe 6 weeks, and if they find benefit, keep going, and if they don't find any benefit, finish off the bottle and don't waste your money. And the last thing is general health and weight. As Dr. Wood alluded to earlier, that the more weight you have, a lot of times it can put a little more compression on the knees. So this woman's woman's coming to the husband saying, sorry, but walking to and from the refrigerator is not considered taking part in a walkathon. All right, thank you.